Hi everyone, thank you for tuning in for today's video. So today I wanted to talk about Skin Cancer Awareness Month and give some tips for ways that you can promote it in your office, not only this month, but throughout the year, just good general tips to have. If you're a patient and not a practitioner, maybe you'll learn something from this video as well, hopefully something that can help you. In the case of dermatologists and derm offices, you may know a lot of what I'm going to tell you, but I'm also going to go over MDPen products that can coincide with your advertising of Skin Cancer Awareness Month. Feel free to ask questions in the comments, guys. I will be happy to answer them. And I will also be talking about the giveaway we are doing on Instagram now through the 22nd of May. So if you are a professional, make sure you're taking part in that Instagram giveaway. It's on the MDPen Instagram account. So it's at MDPen CO, all one word. And go there for the giveaway. There'll be a link for that later in the comments, guys. Again, feel free to ask questions. So when it comes to Skin Cancer Awareness Month, which is the month of May, you definitely want to promote healthy skin and good choices in your office. We all know as professionals, sunscreen is an absolute must. And as we move into these summer months, you have to make sure absolutely that your patients have a good sunscreen on board. With MDPen, we do have our broad spectrum SPF 30. This is packed with antioxidants. It has a very light, nice lotion-based consistency. It massages into the skin really easily. No white powdery residue. This is a very affordable sunscreen. And again, very moisturizing as well. You also want to have an antioxidant product on board for healthy skin and Skin Cancer Awareness Month. So if you do carry the MDPen CE Brightening Serum, definitely make sure that you're pairing this with your sunscreen sales. So this is a great little duo, you can pair together right here. And if you want to discount it, you can do like a 10 to 20% off, something like that. And this one would run around $101.95 retail. Again, you could do that 10% off, bring it closer to $90 for the two products. This is a 21% vitamin C, guys. So this is very high potency. It has licorice, green tea in it. This is going to give you your UVA, UVB, antioxidant, and you want to protect against pollution and free radicals as well. So definitely do this. Let's see, I see some questions coming in. Hi, Alex. As a healthcare professional, what are some of the messages you would convey during Skin Cancer Awareness Month? So hopefully I'm answering that in this video. The next thing I was actually going to say pertains to this question. As a professional, always work, what's in your scope, the scope of your license. So as an esthetician, yes, you are not a dermatologist, and no, you should not be diagnosing skin conditions. However, if a patient comes to you and there is something on their face, that could look precancerous, they tell you that it's not healing, it hasn't healed for months. Of course, if it's a strange looking mole that has, one of those A, B, C, D's, E's that we learn about in dermatology, you need to refer them. You need to tell them, you don't have to actually do the insurance referral, but you need to tell them that they need to consult with a dermatologist. You don't want to treat over that area by any means whatsoever. So just stay on the lookout. I've heard of estheticians doing this, as well as myself, and I saved someone's life. They had melanoma. So keep that in mind. Don't treat over something that you shouldn't. And if you see something alarming, don't scare the patient, but simply tell them that they need to get that looked at. See some more. Good day, Alex. Could you share some practical tips for early detection of skin cancer that individuals should be aware of? Absolutely. So again, I'm an esthetician, and I've been in the industry for 14 years, but I'll give you some advice here. If you've ever been to your dermatologist, a lot of times they have those little cards, the A, B, C, D, E's to check on. And this isn't always easy. I would just recommend getting an annual skin exam at the dermatologist. A lot of times if they see something that's worth watching, that they don't want to biopsy it, watch that mole for changes. You want to look for changes in color, border, diameter, if it's bleeding, anything like this. And one thing that's helpful, if you have a friend or family member, you can take your own digital photos at home of that mole. If it's like on your back, let's say, and they've told you to watch it, take that picture, have it at home, retake that picture, every month, every couple of months. And that's a really good way to kind of monitor things. But the best thing you can do is get that annual skin exam with the dermatologist, and they'll kind of recommend where to go from there. Nothing that isn't healthy or safe for the skin is non-healing. So if something is not healing, it needs to be looked at. If it goes away, that's great. It likely wasn't, cancerous. So that's another thing to keep in mind. Here's that link, guys, for the sunscreen that I did talk about, SPF 30 from MDPen. See some more questions rolling in. Hi, how can individuals, especially medical professionals, effectively raise awareness? So if you're a med spa, I mean, you can only do so much for raising awareness. I would encourage skin exams, encourage the products. If you're an office that utilizes a Visia light that can show actual, everything from hyperpigmentation to melasma to dyschromia, broken capillaries. A lot of times it will show redness and brown, and you can take that initial Visia picture and review it with your patient. And then after doing their treatments and quality medical grade skincare, retake that photo in 6 months, and hopefully there's big changes there to see in the skin. But definitely just pointing out, again, you don't have to diagnose, but pointing out the areas where they do have that sun damage, and then again, just kind of tracking it. Another thing too, as estheticians or as providers, you don't want to go in and start treating skin that is severely sun damaged. So if it has a lot of photo damage, they're not going to get a great result. So the best thing you can do usually, and I always say this, if you're getting a new patient, coming into your office for the first time, do a really nice facial on them, do the consultation, get that initial skincare on board that's going to prep their skin and get it ready, and then have them come back, to start that microneedling series or to do that chemical peel. But if their skin is really thin, dehydrated, sun damage, broken capillaries, you don't want to jump right in and start microneedling them on that first appointment. You're kind of like doing an injustice to their skin. Here's that link for the vitamin CE, guys. Thank you guys so much for your participation in this video. Thank you guys, and have a great rest of the week. Bye.